All right, so it is 3:01. So good afternoon, everyone, and welcome to the Graduate Medical Expansion Informational Webinar. Thank you all for taking time out of your day to join us. My name is Zachary Larry. I serve as the Stakeholder Engagement and Community Coordinator here at HCA. Before we get started, I really want to let you know that this slide deck will be made available on the PCC GME grant website, along with the RFA, the submittable link, and any additional resources. At this time, I'd like to take a few minutes for those involved with the GME RFA to introduce themselves. We'll begin with the Healthcare Authority and the New Mexico Primary Care Training Consortium team. So I can pass it on to Hala Reeder.
Hi everyone, my name is Hala Reeder. I am on the team and helped prepare the submittable application portal. And we can pass it along as long as that audio came through.
Wonderful, we heard you, Hala. Let me see. Nicole, are you able to present your team?
Hi everyone, I'm Nicole Mandel. I apologize. For some reason, my camera just keeps automatically turning off, so I'll try to work on that. But I am the CEO of New Mexico Primary Care Training Consortium, and I'm just going through and looking at the names. It looks like I know most of you, but I'm happy to be here with you and to help present this RFA.
Wonderful. Donna Madrid, are you able to do a little bit of a quick intro, please?
Hello, I'm Donna Madrid. I am the Director of Graduate Medical Education for the consortium.
Awesome, thank you. I also wanted to share that Tristan Maroney, who is with HCA, is a procurement manager. She is unable to join us today. However, I will drop her information in the chat. Just give me 1 second. Let me just open up the chat. If I miss anyone, please feel free to introduce yourself.
Elisa will be joining us shortly. She's the Strategic Planning Director over at the Office of the Secretary.
All right, so before we start, on behalf of all colleagues at the HCA, we humbly acknowledge that we are on the ancestral lands of the original Pueblos of the Pueblo, Apache, and Diné, past, present, and future. With gratitude, we pay our respect to the land, the people, and the communities that contribute to what today is known as the great state of New Mexico. So here's the mission, vision, and goals of HCA, where we ensure New Mexicans attain their highest level of health by providing whole person, cost-effective, accessible, and high-quality healthcare and safety net services. Our vision is that every New Mexican has access to affordable healthcare coverage through a coordinated and seamless healthcare system. So this is the mission and vision of the New Mexico Primary Care Council, serving as a reminder to keep the intention and goals of today's webinar in focus. One of the goals is workforce sustainability, which means creating a sustainable workforce, financial model, and budget to support our mission while securing necessary state and federal funding. Okay, so today's agenda includes an overview of the GME, where participants will gain a clear understanding of the RFA. We'll cover the priority of funding allocation, eligibility, and application requirements, how to apply through submittable, the timeline and where to get help, and what to expect as an awardee. We'll also have time for Q&A at the end of the presentation. So please hold your questions until then. But if you're able to drop the questions in the chat during this presentation, that would be great as well, so that we can answer during the Q&A. Okay, so I'm going to start off with the purpose. So the primary care physician training expansion is authorized under House Bill 480 and directs the New Mexico Healthcare Authority to award funding to support primary care GME programs. The goal of this funding is to increase the number of first-year residency positions and strengthen New Mexico's primary care workforce. Funding allocation, so a total of $1 million is available for fiscal year 2027. The number of awards made will depend on the number of applications received, the amounts requested, and the total funding available. And then I will pass it on to Nicole. Oh, Nicole or Elisa?
I'm sorry, I thought Nicole was covering this. Nicole, are you on? Okay, we're missing Nicole. Sorry about that. So I'll talk through this. Apologies. So the HCA is going to change the way that we do this grant a little bit. So in the past, it's all been focused on solely physician residency programs. So we've expanded that a little bit. So we are still looking to develop new primary care GME residency programs. So if you're looking to develop new, oh, there's Nicole coming in now. If you're looking to develop new GME programs in primary care, those do not have to solely be residencies for physicians. They can be other provider types. So we want those expansions to be happening in underserved areas, so rural New Mexico, those health professional shortage areas. And then no worries, Nicole. Thanks for joining. And then we also are looking to provide some sustainability support with these dollars. So what we found kind of in the last several years, I think we're in our 6th year of developing residency programs, is that some of the programs really need some sustainability financial support to keep them going after they are launched. So proposals for those already established, either that have been established through this funding or have other regulatory issues for funding so that they can stay open would be available. So some of the facility types that struggle with reimbursement for residency type programs include FQHCs, critical access hospitals, and others. So you are welcome to apply for that funding as well. And then we also are looking for proposals that expand to more of the interdisciplinary team-based training programs. And so if you want to or are developing a multi-provider type interdisciplinary program, we are looking to support those types of programs as well. Right, next slide.
Okay, Nicole, I saw you unmute. Would you like to add anything or move on to the next slide?
We can move on. Thank you.
Okay, so eligible applicants, I'll read through this list. You can see it on here. It's also in the RFA, but New Mexico Licensed Hospital, an academic education institution, new or proposed freestanding graduate medical education programs, established or new graduate medical education training consortiums, or federally qualified health centers or rural health clinics, or an independent psychiatric hospital or facility. All of those types are eligible to apply. If you're not sure if you're included in this list, or if you feel like you should be included in this list, but you don't see yourself here, please feel free to reach out to one of us. I believe there is contact information in the RFA, and that Zach can share here as well. Expansions of programs must be existing, new, or planned, nationally accredited or planning to be nationally accredited, and non-military programs. They need to have or intend to have first-year residency or first-year open training positions, postgraduate training positions, and intend to create those first-year positions through an expansion. So we're looking to increase, right, the number of students who have access to training in New Mexico is really what we're wanting to do. And then for the sustainability program funding, those must be open programs that are providing training to folks in New Mexico. Right, and the application deadline is 5 p.m. February 27th. So we have just over a month to get those in. Next slide. All right. So required forms for this application. We are requiring an abstract, a program narrative, a work plan, a budget, a letter of commitment that can be signed by leadership within your organization. That just helps us understand and know that you've had those conversations with leadership within your organization and that they're supportive of the program or funding that you're applying for. And then conflict of interest. So we'll explain some of those more in detail here in a moment. Next slide. All right, so the application link is here. I believe that is also listed on the HCA website. If you go to hca.nm.gov and you click on, do we have a GME grant site or is it under primary care, Zach? Primary Care Council?
It's underneath the primary care. I dropped a link in the chat.
Awesome, thanks for doing that. So it's also in our on our website under Primary Care Council. And then here are all of your contacts. Tristan couldn't be here today. She is someone you can reach out to along with Nicole, who is here with the New Mexico Primary Care Training Consortium, or Donna with the NMPCTC as well, who's also here today. Right, next slide. All right, I'm going to kick it over to Zach and Hala for going over how to apply in Submittable.
Take a moment to find my mute button, but I can jump in on this. So for Submittable and for the application, it starts with that link that's in the RFA and that's posted. When you click on that link, it's going to be that first page under step 1 here. This is how it will pop up. And there's actually a button that says submit. That's how you're going to initiate your application. If you don't already have an account, it's going to prompt you to either log in or sign up. That sign up button is sometimes like a little hidden. So if you don't have an account and it's asking for your email, make sure you click sign up and it will just ask you to add a name along with your email and set up a password. The first form you're going to fill out is that eligibility form, which you can see kind of pictured on the right. That's how it will look. Once you complete that eligibility form, Zach, you can go ahead and go to the next slide. you'll complete the application. The application includes all of the components identified in the RFA. So there'll be the narrative, anywhere where you have to upload documents. There's going to be buttons for all of that. So the entire application is going to be in Submittable, and it will prompt you to just go through and answer those questions or upload your narrative. And then at the very end, you can click Submit. Along the way, you can save your progress. It does have an automatic saving capability, but before you close all of your tabs, I recommend scrolling down, clicking Save, because I don't know at what point it refreshes. So go ahead and save your progress if you like. You can return to it. If you would like to work on your application with someone else on your team, you can actually add people to your submittable application. That's a feature on the top right hand corner of the screen. There's tools on Submittable if you look up how to do that as well, or there's a little icon on the right hand side that can prompt you if you want to collaborate. But I will point out you can only work on your application one person at a time if you choose to use that feature. So always click Save Draft and coordinate with that. And if there are any like questions or troubles with the application, go ahead and send that over to us, and we'll make sure to answer that. It might make its way to me if it's a tricky one. So.
Thank you, Hila. All
Zach,
right,
do you want to go over the timeline? Okay.
yeah. So the RFA is issued by HCA, and the online application went live on January 2nd, last week on Friday. The deadline to apply to applications must be submitted by February 27th, 2026 at 5 p.m. This applies to current programs seeking expansions or sustainability funding, as well as new programs. HCA leadership will review applications throughout March of 2026. They may reach out for clarification, but not all applications will require discussion. Contract negotiations with awarded programs will take place between April and June of 2026. Revisions to budgets or work plans may be required. Funding is expected to begin on July 1st, 2026. So this date is subject to change at HCA's discretion. So I'll give you all a moment to look over the timeline. Okay.
Zach, do you want me to cover this one?
Let me see. Can you guys still see my screen? I think I froze. Okay, wonderful. Okay, so HCA will review all applications submitted for the RFA before the award. Applicants who do not pass screening will be notified within 30 business days after the submission deadline. HCA leadership will make funding recommendations based on the reviews. Ultimately, the HCA secretary will make the final award decisions. After the award, selected applicants will be informed of the funding decisions. Awardees must submit a final award budget for HCA approval. Contract negotiations will occur between April and June this year. Revisions to work plans and budgets may be required. Contract execution and funding starts, so that's expected to begin on July 1st. Awardees expanding programs must verify filled positions to receive funds. And then I'll move on to the next slide. Oh. So now we'll open the floor for questions. So please feel free to ask anything related to the GME Expansion Fund or the application process. If you have any questions you'd rather ask privately or later, you can reach out via email to the contacts listed below. So I will open up the floor.
Hey, this is Dr. Ortega and Alamogordo. Um, so so for us, I mean, we're not necessarily looking at expanding right now, even though I think we are at cap, but we would be interested potentially in the sustainability support. So can you elaborate on what sorts of things the grant could be used for?
Nicole, can I kick that question to you?
Hey, Dr. Ortega. So it's really the first year we're doing the sustainability funds, and a lot of that we're kind of filling out what those funds will be used for. So right now we're seeking people to apply, and we'll go through and review them. The things that are off the table are really things that are already covered by Medicare and Medicaid funding. Anything that would be solely reliant on these sustainability funds without future plans for how to take over and maintain them without the funding source. And those are the big ones right now. Does that kind of answer your question?
I think so. I mean, so for example, I'm just going to throw something out there. Like if we wanted to purchase um, butterflies for, for our residents to be able to use, is that something that just to maybe give us a little bit of an edge or something to help with recruitment? I mean, is that something that would be potentially coverable?
Educational supplies for the residency would be a great use of the funds. Really, those things that are already covered by Medicaid, Medicare, and physical like locations, buildings, things like that would kind of be the ones that are off the table.
Okay, great. Thank you.
Mhm.
Any other questions from anyone? Feel free to raise your hands or put it in the chat. This is a lot of new information and how we're approaching this funding this year. And we're also changing how the applications come in. So we've switched from our old application system to this new application system. And so please reach out to us. The emails are here. We're here to support you. While we can't tell you what to put in your application, we can definitely help you with, understanding the requirements and then understanding the technology piece if you get stuck with that. Um, so yeah.
I'd also like to add, if anybody has questions about the RFA or about your particular application, I'm happy to set up a meeting with you and kind of walk through in more details your specific situation and what you're wanting to apply for and see if these funds would be a good fit for you. So please take my email down, and I'm happy to talk more.
And I do have a question from Dr. Hassan. Thank you, Dr. Hassan, for chiming in. Asking, is there a list of items that qualify under sustainability? The design of an addition of the sustainability funding really is intended for mostly for those programs who don't get the federal matching funds. So FQHCs, Nicole, I'm forgetting the other one, the other facility type that doesn't get that.
Critical access hospitals
Thank you.
and psych facilities.
So if you're one of those facilities, we will be prioritizing those sustainability requests. There is a budget ask for what you want to use that funding for. And so it would really be those things that are outside of what is covered with your current funding. If you're having to pull funding from somewhere else to really cover, to Nicole's point, supplies, I don't think we have a specific list, but if there are items that you're struggling to cover with the existing funding that you get from Medicaid, Medicare, then that's what we're interested in understanding in your application. I hope that helped a little bit. As we understand better what kind of issues folks are having out there with sustainability, the more defined I think we can be at the state with what we're asking as well. So we're really at the beginning of trying to really understand where those gaps are as well. All right, and then Dallas had a question about the RFA. So RFA just stands for Request for Applications. That's the document that outlines kind of what the requirements are. So you'll want to read through that RFA. Yes, before you go into the application itself. You are not too late. You've got until the end of February to read through that RFA document and understand what we're looking for, and then go ahead and put in your application. All right. Great, thanks for those questions. Anything else? All right, well, not too late if you didn't get your question in, or if you think of one as soon as we hang up, which I tend to have that happen when I'm on calls. Feel free to reach out to any one of us, and we'll get back to you with answers to your questions. Good luck, everyone. Thank you so much. Thanks, Zach and Hala and Nicole, for all your hard work getting this together. I really appreciate you.
Can you send this out via email?
Zach, can we put this presentation on the website? That might be the easiest way.
The slide deck will be posted on the Jamie Grant website. And I attached a link in the chat.
Yep. Thanks, everyone. Have a lovely afternoon.